Hi, I'm Ros McDougall. I'm an ethicist at the University of Melbourne. I'd like to start by acknowledging the traditional owners of the land that I'm on today, the Wurundjeri people of the Kulin Nation, and pay my respects to their elders past, present and emerging. So in my presentation today, I'd like to focus on one specific word in the overall session title. So the session was entitled Better Decision Making with Big Data, and I'm really interested in that word better. So in my part of the session, I'd like to unpack a bit what we mean by better. So what makes a decision better? On what basis is one decision superior to another? So how do we know that clinicians and patients have made a better decision? And specifically, how can we ensure that uses of artificial intelligence in healthcare decision making really do lead to better decisions? I'm going to be focusing on AI systems that help with treatment decision making. So setting aside uses of AI in diagnosis, my focus is really on uses of AI in treatment decision making. So my view is that what makes a decision better is the relationship between that decision and the individual patient's values. So I'm sure you're all very familiar with the idea of patient-centered care and the related idea in ethics of shared decision making. So obviously there's a lot of diversity and debate about exactly what these terms mean, but there really is a consensus on the key idea. So the key idea of patient-centered care is about individual patients and their autonomy. So allowing patients to make decisions and to set their own goals about their healthcare. So patient-centered care involves the idea that different healthcare decisions are right for different people based on the patient's own values. So we know that patients value different things and have different goals in their treatment, and an individual patient's values really play a role in determining what constitutes the best treatment option for them. So when we're thinking about the use of AI systems in healthcare, we need to avoid designing AI systems that use fixed parameters to determine goals of care. So in the cancer context, for example, this might be ranking treatment options based purely on longevity or disease-free survival. In other contexts, like osteoarthritis, we know that different patients value different things, so we can't set a single fixed parameter as the goal across a whole patient group. We don't want to be thinking in terms of a particular functional or biomedical parameter and applying that as the goal for everyone within a particular patient group. So the issue with AI systems that do use this kind of fixed parameter approach is that the goals are not specific to a particular patient. We know that patients value different things and they need to be able to make treatment decisions based on their own specific goals, not a preset goal for their type of patient group. A second danger of AI systems that use this fixed parameter approach is that we end up with a kind of computer knows best scenario. So medicine has moved a long way from the old days of paternalism, of doctor knows best. But if we're using AI systems with fixed parameters, this type of approach makes invisible the values aspect of medical decision making, and we risk moving back to a situation where computer knows best, where computer that are seen as the kind of source of knowledge and the determining factor. So rather than AI systems that use a fixed goal for a whole patient group. We need what I call value flexible design. So this is the idea of building into these type of treatment making tools the ability to incorporate different values based on the specific user. So in discussions of AI more broadly beyond medicine, there's really an increasing body of literature arguing that there are always values built into AI systems, whether they're visible or not, and that these values need to be thoughtfully chosen and made explicit. The focus in those broader AI discussions, though, tends to be on community values or shared values. So what are the values that we as a community want built into a particular system? But for AI systems in healthcare treatment, we need a different type of attention to values in design. We need more than design that's just attentive to kind of shared or community values. We need systems that allow for diversity amongst the values of individual users. So we need value flexible design where built in is the capacity for the values on which decisions are going to be made to change depending on the individual patient and their own goals. So we need systems that allow for diversity amongst the values of individual users and can incorporate different values into decision making based on that particular patient. So to keep patient-centered care in our healthcare approach as big data and AI become more prevalent, we really need to focus on systems that allow patients to be individuals with different goals and values for their healthcare. So coming back to the question that I posed at the outset, what makes decisions better? Better decisions are decisions that align with the patient's values, that enable them to live their own individual lives, achieving the things that are important to them. So we need to ensure that we use big data in a way that allows for those individual value differences. Thanks for your attention. If you're interested in reading further, I've included a reference at the bottom of the slide where I've talked about these ideas in more detail, and I'll look forward to the Q&A panel. Thanks.